Medical ethics, part 2. See, the situation the doctor faces are entirely different from other situations. A lawyer has got a time to study the case sheet. The agriculturist or a businessman has got more time. But the doctor has to decide the situation for himself and against so many odds, which very few people realize. Once a patient was brought to my consulting room at about 2 a.m. in the morning. I just see her, there is no pulse. The patient was bitten by some animal, some insect. She is pulseless, she is in acute shock. I have to revive her with life-saving drugs. But the result is unknown. Whether she will survive or not, I do not know. Supposing, unless the patient has got all the confidence in me, how can I treat the patient? They will say that I have killed her, I do not know this or that. Yeah, is it safe to send the patient outside for half an hour for treatment when she is sure to die? No, I must take the responsibility. How can I take the responsibility of the patient? I just asked her, from where are you? Then I immediately started the treatment. She is the elder sister of one of my students who happens to be an oncology surgeon, very famous oncology surgeon in Madras. Then at 2:30 I revived her and I was able to contact her. See, this you must understand, I should have a confidence in the patient and the patient's relatives that they should be accepted. I can do my best, but unless you accept my confidently, I cannot perform my best to the patient. A risky patient, I may be rather for fear, I may be not be able to do the best. So this the public are not realizing. Another important, I will tell you some of the instances in which I have gone through. Once a patient from only a few instances, then I will go to the ethics proper. Once my student from Nedamangalam phoned up to me. He said, "Are you in town, sir, this evening?" I said, "I am very much in town, I will wait for you. I will go to the rounds and I will wait for you around 7 o'clock. He came down from Nedamangalam, he is a PhD medical officer. He came down with his lungi and shirt, very unusual dress. I asked him what brought you here. Sir, there is a patient with hanging this one in the front of in my house in the front door. They are not permitting me. They are requesting me to treat the patient there itself. They will take back the patient if he dies. They will not permit me to transfer the case to any other hospital. I must treat there only. They are willing to take home. They cannot afford to come here. They cannot afford a taxi. They are threatening me to treat the patient." See, how did you come? I came from the back door. I jumped to the compound wall. I took a taxi from a neighboring medical shop and I came without knowledge. What for? Sir, I want to know whether anything best can be done. You can put a catheter, you can give betnesol, but cervical spine fracture, quadriplegia, the patient will die. Why not you shift? Sir, some of them are related to me. They are very poor. I am also a relative of them. I cannot enter the village the next day. See, look at the situation. And what will happen if they come here? The same thing, he may die in another 1 week or so. Then postmortem, then transport, all the expenses. See, it looks very clear on paper. But practically, what the PI should do, he is not permitted to leave the house without treating the patient. The patients are willing. Say, I leave it to you what the patient should say. Say, I am in the court. I am standing in the court, in a sessions court, in a divorce case. The lawyer is asking me the question that he wants me to answer the operation I have performed. He does not permit me to tell the disease the patient has got for which he was primarily treated, though it is in the case sheet. He says, answer my question only. You are to answer direct questions. I have paid for you as a witness, he says. I told him, I am sorry, sir, you are misdirecting the court. I may be taken for any punishment. Then I gave the case sheet to the judge and told the public prosecutor that the patient has got some other disease and which is hidden by the. See, you have to take bold decisions. To take bold decisions, I must know my background. I should know that I will be able to stand this one. So there are a lot of things. Medical ethics means the doctor who is treating the patient has to decide on sometimes most often on moral and human grounds. Ethics may be there, and law may take another stand. The law can wait, the legal points can wait, but you must save the life of the patient. That is utmost importance. You cannot be quoting rules and sending the patient away. And at the same time, people, if you will feel happy if people stand by you to support you. I can tell you a patient who was just brought from the first night of our a newly wedded couple. They are facing the first night. The patient is brought, the lady and her husband are brought. 2 or 3 more vehicles are following, and I examined the patient. She is 5-6 months pregnant. She confesses to me that she is already pregnant. She was in love with somebody else and she is pregnant and she has married this fellow. The husband is standing outside wanting to know whether it is pregnancy or not. I will tell you how we manage the situation later. See, a word from your mouth may kill your patient, may bring down the reputation of the patient, may create some other calamity. At the same time, it may bring down your reputation, it may pull you down. Sometimes even for doing right things we are scolded upon. People should understand that the doctors are the precarious lot in the society, that everybody starts blaming. You are looking at the results, you are not looking at what we are undergoing. We have to decide in a minute. I have to decide by myself. I have no consultation. At 2 o'clock or 9 o'clock in the night you come with a particular disease. What am I to do? That means medical ethics is entirely different. That is, you have to take a bold steps, you have to do an honest step, you have to do an ethical step, you have to do a legal step, you have to do a moral step, and all these steps should be your own, and you have to decide yourself. I have treated ministers, I have treated I have treated VIPs, I have treated more people, and I have treated the poorest of the poor people also. But on everything you must have a human kind, and if you stand upright and human, nobody can shake you from this one. And but they say trying to erode and giving rise to authority, obliging the authorities, or trying to please, they ultimately end up in a very bad situation.